One of the most common questions I get asked is, should I take the English test first or should I prepare for the OSCE first? A lot of people assume English is harder, so they want to get it out of the way first. Some also believe that preparing for listening, speaking, reading, and writing will automatically help them perform better in the OSCE, but actually it works the other way around. Let me explain why I don't recommend taking the English test first. First, English results have an expiry date. If your OSCE process gets delayed for any reason, your English score might expire before you complete all the registration requirements. That means you may have to sit the test again. Second, the score requirements can change. Recently, English score standards have been adjusted and are trending lower. If you take the test too early, you might realize later that you worked extremely hard for a score that was higher than necessary. On the other hand, if the requirements suddenly increase, your previous score may no longer meet the new standard. When you formally apply for registration, you are assessed based on the rules at that time. Now let's talk about whether English preparation actually helps with the OSCE. Many people think it does. In reality, not really. Each OSCE station is 10 minutes. You have 2 minutes outside the room to read the scenario. Once you enter, you only have 8 minutes to communicate with the patient, perform the task, and complete documentation. In those 8 minutes, the communication is structured and quite fixed. What you need to say follows a pattern. Our course will specifically focus on this. Even if you don't fully understand what the patient says, asking for clarification does not cost you marks. Examiners want to see how you function safely in a real clinical setting. The simulated patients are trained actors, and they understand the time pressure. Also, the reading and writing tasks in English tests are very different from OSCE. The vocabulary, format, and logic are different. Preparing for English tests does not directly prepare you for the OSCE. Now here's the important part. Preparing for the OSCE first can actually help you with the English test, especially OET. During OSCE preparation, you practice real clinical listening and speaking. You learn clinical workflows, patient charts, assessment logic, and structured communication. Many of these elements appear in the OET as well, so the skills transfer across. So my recommendation is this: prepare for the OSCE first. After you sit your OSCE, you usually have 4 to 8 weeks while waiting for the results. Use that time to prepare for your English test. That way, when your OSCE result comes out, your English result will likely be ready as well. Once you have both, you can proceed straight to registration without delay. If you want structured, examiner-led OSCE preparation with real marking insight and guided practice, visit our website at www.nursesucceed.com.au to learn more about our OSCE examiner-led preparation course. You can also DM us or WhatsApp us directly if you would like personalized advice about your situation. Plan smart, prepare strategically, and we look forward to supporting you on your journey to becoming an Australian registered nurse.